今日感染病毒嘅人數又創新高啦。喂，
呢度係衛生署打嚟，而家懷疑你感染咗新冠病毒。
喂，我而家邊忽似感染咗啊？今日又冇出過街，都唔知係咪騙案嚟嘅。陣間有可能要我俾錢做化驗。
嗱，而家唔係事必要你講，但係你所講嘅一切都會成為我哋追蹤病毒傳播嘅關鍵。我哋嘅人員將會喺1個鐘之內到達你嘅居所。請你到時執齊包袱，同我哋嘅人員一齊準備入隔離營啦。
喂，大佬啊，1個鐘頭有邊夠執咁多嘢啊？唉，真係麻煩。依家唔出得街不特止，仲想搵我入監倉？我呢啲人啊咁有才華，點可以咁鬼早死㗎？不如我趁住呢個鐘頭離家出走算啦。喂，有冇咁靈啊？講下笑啫，唔使咁認真啩？喂，你哋煩夠未啫？我執埋個攬枕啊落嚟啦。
喂，等，乜嘢落嚟邊度啊？我係 Henry 啊。
喂，原來係你啊！我仲以為係衛生署又打過嚟煩住我添。
啊，衛生署揾過你啊？究竟咩事啊？
哦，頭先佢哋話懷疑我中咗招，叫我1個鐘內執嘢走咯喎。咁到底點解呢1-2日明明又冇出過街，我身體又冇咩唔舒服，仲有可能中招嘅？
有冇聽過潛伏期呢樣嘢啊？亦都有可能係交叉傳染，又或者可能無症狀感染呢？
喂，點解一隻病毒仲可以煩過阿媽㗎？咁到底病毒同疫症呢啲嘢有冇譜嘅啫？
當然有，就等我哋 call 港大嘅高本恩教授 Professor Ben Cowling 解答你一切嘅問題啦。
So, what exactly is a virus? Can you explain what is its structure?
A virus is an infectious agent. It's not alive or dead. If it can get into your body and infect your cells, it can use your cells as a factory to reproduce itself. And that's how viruses propagate. So, for example, COVID-19, the virus that causes that, could get into your lungs. Just one virus can get in. It can infect a cell, turn that cell into a factory, and produce thousands, tens of thousands, hundreds of thousands of copies of itself, which then might go into other cells in your body. Some of them might make their way out and infect another person. And that's how virus is able to spread from one person to another and spread all the way around the world sometimes. They use our bodies as factories for themselves.
So, moving on to the next question. So, we have heard about these words, epidemic and pandemic, showing up quite often. But what is actually the difference between epidemic and pandemic?
So the definition of epidemic is when number of infections of a specific type rise above a level and become maybe noticeable or of concern. So for influenza is a really good example. Often that people can get flu all around a year in a place like the United Kingdom or the United States. People bring back infection from overseas, even in the summer. But you only tend to see influenza spread in the winter months. So we'll have an influenza epidemic, which lasts for maybe 6 weeks, 8 weeks, 10 weeks. Also true in Hong Kong. We have a winter flu season most years, lasts for 6 weeks, 8 weeks, 10 weeks. And that's when there's more of influenza going around. Lots and lots of people getting infected all around the same time. And then after the epidemic's finished, then the virus kind of goes away. It may not go completely to zero, but it goes away and it's not really a concern until the next epidemic comes along. A pandemic is when we have a brand new infection that spreads around the world and causes epidemics everywhere it goes. So whereas with flu, some places will have an epidemic from one year to another. If there's a new strain of influenza, like we had in 2009, or with this COVID-19, or with other infections, when that emerges, it spreads easily around the world because lots and lots of people haven't ever had it before. That's when we have a pandemic. And pandemics are really a particular concern for public health because they can have such a high health impact, as we're seeing now with COVID-19. But we've had other pandemics in the past 10, 20 years. I mean, Zika virus was a seemed like it might be a big concern. And then it turned out after a while, we decided it wasn't such a big concern after all. 2009, we had a pandemic of influenza, 2009 H1N1, which everybody was worried about in the very beginning. And then they decided it's not such a big deal compared to seasonal flu. COVID-19, though, I think is going to change everybody's perspective on pandemics, that we've been worried about this kind of thing happening for many, many years. And now it's here, and it's really demonstrating the danger of these kind of pandemics, that it disrupts the whole world. So many countries on lockdown, so many people getting sick. Here we're about millions and millions of cases on a daily basis sometimes.
So to conclude, then epidemic is mostly local, and then many epidemics can join to form a pandemic which is global.
Yeah, pandemic by definition has to be a global event when there's a new infection that's spreading around the world. Technically a pandemic is also like an epidemic, but it's an epidemic around the world. It's not just an epidemic in one place, but epidemics could be local.
Yeah, I see.
So, Professor Cowling, as a leading expert in epidemiology in your field, can you brief us, like, what actually is epidemiology? What do epidemiologists study? And in your past research or your current research, what are your main approaches or perspectives in studying these epidemiological problems?
Sure. So, epidemiology is the study of people's health in populations and the application of that knowledge to improve people's health. So the first thing that we do is to study, what do people get sick with? Sometimes what do people die from? And why? Why do some people get diabetes, others don't? Why do some people have heart disease, other people don't? Why do some people get COVID-19, other people don't? And then when we can understand the processes, we can make recommendations to governments and ministers for health and so on what they could do. For example, with COVID-19 spreading, we recommend you consider asking people to work from home, or, should you keep schools closed? Should people wear masks? All these kind of questions are the questions that epidemiologists answer. So whereas doctors, medical doctors, focus on the patient that they're seeing in front of them, what's the best thing to do for this patient? What treatment should I give them? What diagnosis should I make? What surgery or other procedure should I do? In epidemiology, we're focusing on populations. So we're thinking about what's the characteristics of people who get sick versus who don't. And individuals are kind of aggregated together. So we're analyzing quite often larger data sets and looking for patterns in the data set. So using statistical techniques and also using our knowledge of diseases and disease processes, all those kind of things. So there's usually no undergraduate degree in epidemiology. It's a postgraduate subject, because it's advanced and it borrows from a lot of other disciplines. It borrows from medicine, from health sciences, from biological sciences, from statistics and mathematics, economics, business studies. So many different disciplines all go together to form the field of epidemiology. And epidemiologists have to know a little bit about all those different disciplines in order to be good at their jobs.
I think it will be interesting for our audience to know a bit about the theoretical rationale why vaccines could work in some cases. And so, I know the vaccine is inducing passive immunity in humans. And how does vaccine actually work on the population level to contain an epidemic like this? And where are we about in these rays of vaccination?
So I can do a little bit of history, a nice story. Going back hundreds of years, there was a scientist in the United Kingdom identified an interesting phenomenon. It was about smallpox, actually. He identified the strange phenomenon that milkmaids, that's the girls who milk cows, didn't get smallpox. And cows have a very similar infection to smallpox. It's called cowpox. So he had a hypothesis. He said, what if he could give other people cowpox? Would they also then be immune to getting smallpox like the milkmaids were? And so he got some concoction related to cowpox and he injected it into some people and then demonstrated that after the inoculation, they were immune to smallpox. And that was a really brilliant idea. So he was giving the people a milder infection to protect them against a more severe infection, noting that the immunity seem to go across the two different infections. Nowadays, we have vaccines against a lot of different infections. The most common approach to vaccination is getting the virus of interest, killing it, and then injecting it into you. So, for example, we get the influenza virus, we kill it, and then we inject it into your bloodstream or into your muscle, and your body will generate a response to that particular dead virus, thinking that it might be alive. And so if you were to encounter that virus in the future, you'd have some immunity against it. Maybe not perfect immunity. You might still get infected, but you might not. So there's some degree of protection that you can get from that kind of vaccination. There's other types of vaccine, like there's a nasal spray flu vaccine, there's a polio vaccine, which is a live but weakened pathogen. So we'll get a virus like polio or like influenza, deliberately weaken it in the laboratory to make it a milder variant of itself, and then infect a person, me or you, with that weaker virus. So we'll have a very weak and very mild infection and then develop immunity against other types of the virus. And for the polio virus, the live vaccine works really, really well. It's really a good idea. There's just one tiny problem, that sometimes the weakened virus gets its strength back. And so something like 1 in a million people who get the live polio vaccine actually develop polio, which is not good, So that's why live viruses are sometimes, you have to be a little bit careful. And unfortunately, vaccines don't always work the way we intended. There are some stories in the past 50, 100 years of vaccines that have been tested, and it turns out not only they don't work, I mean, that would be one problem, but they make things worse. So in other words, you get a vaccine that's an experimental vaccine, and then later when you encounter the disease, and you actually get a worse form of the disease than you would have done if you hadn't been vaccinated. And so for COVID-19, scientists are being really, really careful about the vaccines that are being tested and the vaccines that will eventually be used, because we want a vaccine that works. If a vaccine is tested and it doesn't have any effect, then that's bad news. But if there's a vaccine that's tested and it makes things worse, that would be a total disaster. And so we really want to avoid that. And so there's a number of procedures that scientists need to go through when they're developing these kind of vaccines, especially for a new disease like COVID-19, to really make sure that the vaccine is going to be going to work well.
Great. So also back to a little bit about SARS. So after SARS, it's now there's a more than a decade gap between SARS and COVID-19, and I'll be really interested to know, like, if the Hong Kong the public health system, or let's say the governance, has built up some sort of capacity during this period in between the epidemics that actually strengthen the system itself to prepare a unknown pandemic, well, like COVID-19 before it got breakout. What sort of public health system capacity has been built up since then, since SARS?
Yeah, so a lot of investment was made in the systems in Hong Kong to prepare better after SARS. So the first thing is surveillance. When SARS first came, it took a little bit of time to detect that it was a new virus and to identify what the virus was like. So that delay is now much shorter. For COVID-19, we were able to identify very, very quickly that it was a new coronavirus. And the way we can do that now is with more advanced technologies that have been available, and also more capacity for laboratory testing. So 15 years ago, if you or I got admitted to a hospital in Hong Kong with pneumonia, we wouldn't be tested. The doctors would try and figure out what treatment they could give us, that would cover all the bases. Whatever we had, they'd give us antibiotics or some other thing, some supportive care, and trust that we'd get better. Nowadays, if you or I was admitted to a hospital in Hong Kong with pneumonia, we'd be tested for everything that the doctors can think of, because the laboratory testing capacity has been built up, so that in the past, most people were not tested. Now most people are tested. The second thing that's really been strengthened is isolation rooms in hospitals. Those were really critical in SARS, but we didn't have a lot of them. Now in Hong Kong, we have about 30,000 hospital beds, and more than 1,000 of those are these special isolation rooms for people with nasty infections that we want to keep away from the other patients. And that's been really, really valuable in COVID-19. And the training for infection control staff has been really improved as well. So I mentioned earlier about SARS that, one of the key things was getting doctors to wear masks, to wash their hands, to wear the other equipment, and to be really, really careful around SARS patients. So that's now ingrained in doctors and nurses in Hong Kong after 15 years. And we see we hardly have any infections in healthcare workers in Hong Kong. Hardly any doctors or nurses have got COVID-19. But you compare that with Italy, with London, with New York, so many doctors and nurses got infected. And that's because they have not invested in the training and the equipment and the preparations that we've done in Hong Kong. And then one last thing is we recognized in SARS that one of the ways that was able to allow us to control it, to get on top of the situation, was by doing what's called contact tracing. That means if you or I had SARS in 2004, the government would figure out who we might have infected. So maybe our family members or our friends, and track them down and get them into a special facility for quarantine, maybe a hotel, a holiday camp or somewhere, so that if our family members had unfortunately been infected, they'd already be isolated before their symptoms even appear, and then unable to pass on infection. For COVID-19, contact tracing has been a really, really important thing to do. And Hong Kong's been really good at doing it. Singapore as well, and they were affected by SARS in 2003. Other parts of the world, really not so good, and now learning how to do it. And you may have seen the World Health Organization recommending that contact tracing is really an important thing to do. And so Hong Kong's ahead of the game on that, because we learned all about that in 2004 and have been ready for it ever since. Other parts of the world are really, just learning about it now.
所以原來病毒係咁樣一回事。今日真係學咗好多嘢啊！除咗知道病毒嘅結構同埋傳播方式之外，仲了解到流行病學家嘅工作同埋政府防疫措施嘅意義。
咁你嘅問題係咪得到咗解答啊？
我仲有個問題想問噃。
你問下我啊，睇下我答唔答到你。
點解我買咗咁多次六合彩冇次中，偏偏我要中隻咁嘅病毒啊？喂！